With back-to-school season in full swing, parents are dealing with more than just homework. That's for sure. There's also the wave of germs hitching a ride home from the classroom and staying like a house guest for 2 weeks. So here to discuss the health hazards your children might be carrying home and what you can do to keep the whole family safe is pediatrician Dr. Dina Kulik. Dr. Kulik, welcome to the show.
Thank you for having me.
Well, it's great to have you here because we're going to start off strong with that stomach flu. So how do we know it is a stomach flu? It's not just, a kid who doesn't want to go to science class.
Of course, of course. So typically we see the stomach flu around this time in the fall and the winter, but it could be all year round. And we're typically looking at symptoms like vomiting, diarrhea, belly pain, sometimes fevers. Kids feel crummy and achy and uncomfortable, but easy to treat. Most of the time you just need fluids and rest, sometimes medicines for fever, for pain, like Tylenol or Advil, and most of the time it goes away within a few days. We do worry, though, if kids are not drinking at all. So if you can't get your child to drink anything, if they're losing consciousness, if they're having tons of losses, but you can't really restock those fluids in them, that's when you want to see your healthcare provider.
Okay, moving on here. Time not our friend, because we could talk for an hour about this. Many kids are catching a cold, and it can potentially turn into, and I always feel like I'm mispronouncing this, croup?
Correct.
It's croup. What is it for people at home, and what should parents be doing about it?
So also a very common virus this season, and essentially it causes a very characteristic barky seal kind of cough, and also a sound called stridor, where kids have difficulty breathing in, that kind of sound, coughing, sometimes difficulty breathing, and it can be quite scary for families and for parents.
So we actually have audio of that sound. Can we just play this for people at home, please? Yeah, that can linger.
I know that cough.
Yeah.
You know that cough.
I kind of knew that cough.
Yeah,
I did.
So usually caused by a virus called parainfluenza, common this season. And again, most kids do quite well with it. A lot of kids will benefit from humidity. So putting a humidifier in the bedroom, taking them outside to breathe in the humid air, cracking a window. Sometimes kids will need a certain medicine called dexamethasone to decrease the inflammation of the vocal cords, which is what's causing that respiratory distress. And again, fluids, medicine for fever and pain, and rest.
And home from school.
Absolutely
Home from school.
Yes.
Hand, foot, and mouth disease. That is something that I think we've heard of. We might not necessarily know what it is or how it presents.
Yes.
But that's another option
Yeah.
on the menu of problems this fall for kids.
Absolutely. So it causes a very characteristic type of rash. Most classically, little pimples or blisters on the hands, the soles of the feet. A lot of kids will get rash in the diaper area. Could be head to toe, though, and fever and sore throat, because kids will get these little pimples or blisters in their mouth at the back of the throat. Same deal, though, making sure they're drinking, making sure they're staying hydrated, Tylenol, Advil for pain management, and usually lasts about 3 to 5 days.
And is that only in little, or that can go all the way up?
Adults can get it as well, actually. It's most typical in kids less than 5, but absolutely adults can get it. My husband got it when my third had it, and it was brutal, actually. When adults get it, they tend to get a lot of mouth lesions, a lot of pain and discomfort, but most typically in the first 5 years of life.
Doctor, 30 seconds. What is the first thing a parent should do if they suspect any of this is happening? If they hear a cough, they don't like it, what should happen first?
I think making sure your child is comfortable, that they're drinking, that they're interacting with you. Certainly if your child is not drinking, having difficulty breathing, losing consciousness, you want to take them in to be seen. But otherwise, just pain management, comfort measures, and fluids.
And it's tough because you obviously are a parent and you want to care for them, but sometimes that proximity can then have that transfer onto you. So you're also trying to prep your own immune system to be able to sort of get that battle, and washing hands, right?
Washing hands, masking when you can, keep your distance when you're able to.
Yeah.
Where can people find you online?
At Dr. Dina Kulik on all the social media platforms, kidcrew.com, as well as drdina.ca.